medicine is not a transferable skill.
It is not.
It's really
Because
not.
as doctors, what else do we
What
know
else do you really
apart
do?
from-
Imagine what else. Now you've left the career. What else?
We know
is
nothing
open?
about politics.
Or math,
We don't know anything
or
about math.
anything. You literally you don't know
Yeah.
anything about anything,
Yeah.
which is so sad.
Yeah.
Yeah.
Yeah. That's why you find doctors chilling with doctors, with fellow doctors.
Because nobody else will even understand that.
like-
Plus, that's why for me, honestly, I always recommend to people, like before you even go to medical school, is please be very sure that this is actually the career you want.
Yeah.
And for you to be able to do that, if you can actually take time and go maybe intern for a doctor, or actually look, if you can hang around doctors, ask as many questions as you can. Assalamu alaikum and welcome back to another episode of the Cultured Voices podcast. I'm your host, Dr. Fatima Muhammad. And you guys, I know I took a long break, but trust me, I really, really deserved it and I really needed it. So welcome back. And I hope you guys have enjoyed your break, but I'm also hoping that you are ready for another season of the podcast, inshallah. Today, I am actually talking to one of the people that I've known for quite a while. And in this episode, I'm actually really, really excited about, because we'll be speaking about what it takes to become a doctor, and like the real scenes, like the behind the scenes, behind the the white coat and the actual titles.
Okay.
Assalamu alaikum. Tell us how you're doing, and maybe if you can introduce yourself.
Okay, so for introduction, my name is Dr. Abdullahi Okash. I'm a senior medical officer. I've been practicing for the past 5 years. And I'm so honored to be here.
Oh, mashallah.
Finally.
Actually, I am
So
more
long
honored.
overdue.
So much so. Because we've been planning this, I think, from the time I started the podcast. Yeah, we've always been talking about it. But
at least
busy timings, but alhamdulillah, I'm very happy that we're here. So we're just going to start with, I think you already mentioned that he's a medical doctor and he's been in the field for quite a while now. So the whole point of this episode is just for us to understand what being a doctor actually takes. So if you can take us back to like maybe what inspired you to become a medical doctor, or what is like, the story behind that.
Okay, so obviously I grew up here in Kenya.
Yeah.
Spent all my life in, primary school, high school, just the usual. And when I was done with high school, I managed to get a job at some, hawala.
Yeah.
Yeah.
The money transfer. What is it
the
called?
money
Forex?
transfer, Forex exchange bureau, whatever. I've worked there for, I think before I made the decision I was working there at least 4 months in.
Mm.
So I was like, okay, I've done the 8-4 system and I'm yet to do the other 4. And I was like, I can't, stay here. I don't see my life ending in this place.
Mm.
I wasn't too happy with being a bank teller or, calling people to come pick their money and stuff. Because obviously when you're starting, you start with those.
Yep.
Yeah. So one day I just made up a decision, I need to, study. But it wasn't something inspirational. There's nothing that really happened in my life or to a loved one or anything of that sort for me to reach that decision. It was more of a casual decision. I was like, what can I do? I wasn't good in physics, so engineering was out of the picture.
Okay.
Not argumentative, so no out of the picture as well. So I said the only thing that makes sense is, studying medicine. I had this idea and then I talked to my dad about it and I was like, the other way, it should have been the other way around.
Yeah.
It should have been my dad convincing me to go into medical school.
Oh, wow. It wasn't?
It wasn't. So it was me going to him to seek advice. But then I was like, knowing myself and the amount of social life I had in Nairobi growing up with all these friends and everything, I did not see myself doing medicine in Kenya. So one time I'm walking home from job and then a friend of mine, I met a friend of mine who we finished high school with. So I told him, what is your plan? What plans do you have? He says, I'm planning to do engineering. And I'm actually at the moment trying to get a letter of acceptance, or, getting an admission letter
Yeah.
to the university. And I was like, okay, where are you planning to do that? He said, I have my siblings in Ukraine. I'm planning to do engineering in Ukraine. And I was like, okay, do they have medicine, courses and stuff? He's like, yeah, even both my siblings, his sister,
They were doing medicine
they
at
were
the
doing
time.
medicine at the time. And he's like, it's so easy. You just have to get your documents. We send, you get a letter of invitation, you get your visa. In no time, you're out of, on your way to the university and stuff. I was like, okay, it's that easy, yeah. And then I went back to work, Googled the universities there, blah, blah, blah. Shared the information again with my dad, and he was like, you know what? We're going to do that, but let me look for someone. I know a friend of mine whose son also studies medicine in Ukraine. So we got hold of the guy. And that's how it happened. That's how I ended up there, and I did my medicine
That's
course for 6
incredible.
good years.
Wait, so when you were actually like thinking about the fact that like maybe you were not good at physics, and that's why engineering was out of the picture, did you actually sit down and like made that decision intentionally?
Yeah, I did. I did make it intentionally because I was thinking, I think my second best thing would have been to become a teacher.
Oh,
Yeah.
yeah, I can see
because
that.
You can see that.
Yeah, I think it actually
Am I
you're
that
very
strict?
patient, but you're also very patient.
I'm very patient.
yeah.
Yeah.
I think
So
it takes patience to become a
yeah,
teacher.
it
Yeah,
does. It does. It does. And I used to think that they are very helpful.
yeah.
They shape you
They
who
really
you
do.
become. So I was like, the only other thing that makes sense after medicine would be to become a teacher.
Out of the topic, but do you remember any of your teachers?
Yeah, I do. I do. I do remember my teachers from primary school, let alone high school.
Wow.
Yeah.
I actually remember
Even
one
though I'm not
teacher.
in contact with them.
Yeah.
So
I remember one teacher called Teacher Margaret. And then in university, I remember my Chinese teacher actually. That's the only teachers that actually like come to mind.
Yeah.
Yeah. But it's very interesting.
Yeah.
Okay, let me share what made me actually go to medical school.
Okay.
For me, when I was younger, there was a time I had a random weird asthmatic episode. And it wasn't really asthma because I didn't really have asthma. Like I've never had asthma. But then I had a weird episode of the time. Like I think I was like 12 years old or something. Like I couldn't breathe for like a few minutes. And then we ended up going to Karen Hospital.
Oh my God.
And when we went to Karen Hospital, like now there's a doctor there. I don't remember his name actually. But there was a doctor there who ended up seeing me, and he was the nicest man. And I was just so intrigued by this man and how, like, what kind of career he's doing. So I just started asking him questions. And I was always a curious child. So I was always asking him questions. I was like, okay, what do you do? What is this? Like, how did you get here? Like, how did you actually become a doctor and all of that good stuff? So he was just telling me. After that, we started like contacting each other for a few months, I would say.
And at this time, how old were you?
I was 12. I was 12.
12
I was 12 years
Okay.
old. It was right before I went to high school, actually. So by the time I was going to high school, I already kind of like, and obviously, like this high and mighty doctors, and it's honestly the best career. Like obviously that also got into my head a little bit,
Facade.
right? And we'll get to that, inshallah. But obviously, so the whole thing, and obviously my mom was like super happy. She's like, oh my goodness, that's amazing. And I like that you're actually interested. But I was honestly really interested in it. Like, and the interest came on my own.
Yeah.
So that doctor really inspired me. And I ended up like trying to figure out, researching what I really needed to become a doctor. So by the time I was in high school, I actually didn't take physics because I was already aware that you don't need physics to go into medical school. And a lot of people actually think that you need all three sciences.
No, not really.
Which is not really the
biology
case. Even though I think there are some countries and some maybe I'm not really so sure, but maybe there's some places who need it, but a lot of the places
I
don't.
know of Romania.
Yeah. I
One
think
of
there's
the
some places that
requirements you have
really
to have,
require all three sciences.
Yeah.
But at the time, like I was aware that I didn't really need physics, and I wasn't a huge fan of physics anyways.
Yeah.
So I ended up dropping it. I only took like the two So yeah, that's one of the, like, I don't think I've ever told this to
Now,
anyone.
now that we are just having a conversation,
Yeah,
just a follow-up question.
yeah.
You studied where and
Oh yes, I
why?
think I already mentioned this
Yeah,
on the episode, on the podcast. But I went to China
yeah.
and I
Why
studied
China?
in Wuhan University.
Yeah.
And everybody who hears Wuhan, oh, is that the city that went to like had Corona?
COVID.
Yes,
That's where
yes,
COVID came from.
yes. That's where
Yeah.
the COVID came
Mm-hmm.
from. But yeah, that's where I studied. And
No,
actually,
why China? Why China?
why China? It was just also really random. Like I think the same exact story that you have.
Okay.
Like I was looking for medical school. We had heard of Indonesia and China, and then there's a family friend that my mom knew whose son was going to Wuhan University.
Okay.
So we ended up contacting like some people there, and I ended up getting the admission in Wuhan
Oh,
University. Yeah, very similar stories.
that's good. That's
Yeah.
good.
Okay. So another question that I had
Mm.
is life in uni. How's life in uni as a medical student?
It's hectic.
Tell
It's
me
just
about it.
exams, never-ending exams, textbooks, and I don't know about you guys. Us, we had a daily grading system. So we do have lectures,
Yeah.
but you go to classes. You are divided into groups. Each group consists of at least 12 students, maximum 13 students, and then each and every teacher has a register of these 13 students. So when you go to class, you get asked questions. You're not going to be taught anything.
Wow.
The lectures are there for you to be taught. There's a school website where you log in and you read your topics. You know which topic you have tomorrow. Like let's say if you have, let's say, anything related to cardiology, let's say you have myocardial infarction or something,
Yeah.
or coronary artery disease, whatever. So you study in depth. You start from the definition all the way to the prognosis, from
Wow.
signs and symptoms.
So every time you come into class, this is like you
These are
have your
just questions.
I love
And it's not like an open book questions.
Yeah.
You close all your books. You're told stand up, like the way we used to do in Duxi.
Wow.
They tell you, okay, Fatima, please stand up, and then they ask you questions. When they ask you questions, so they grade you depending on how you answered. Maybe you might be asked the definition. The next person will be asked signs and symptoms. So the highest grade you can get is 5 for that class. The lowest you can get is 2. So if you get 2, that means you have to repeat that topic. You have to look for a specific date where they do rework classes. So you have to be there and do those rework classes. The least you can get is 3. 3 is just average.
Average. Yeah.
Yeah. 4 is good, 5 is perfect. So so we used to have that. So and the attendance was 100%.
Yeah, you can never not go.
100%.
Yeah.
You can never not go.
And how many were you like in a class?
13, 12.
Like the whole class?
No. We were over 200. I think.
Wow. And they did that like all.
Yeah,
That's amazing system.
Yeah. So Ukraine is well known for its universities. In one city, you can find 3 or 4 medical universities in just one city. So plenty of students used to come there from different walks of life. India, Azerbaijan, Nigeria, Kenya, Somalia,
Wow.
anywhere, Egypt.
Same by the in China as well. Like
Yeah.
we had a vast collective of like different countries and nationalities in.
So at the same time, there were a lot of challenges because it's a whole new environment.
Yeah.
You're so used to really good weather, fresh food. Not that I'm saying Ukraine doesn't have fresh food.
No,
But,
like once you leave Kenya
Yeah.
is when you actually realize how good we have it here.
People say
Yeah.
you only miss Kenya when you're out of
When
it.
you're out, that's
Yeah.
true.
But anyway, so there are a lot of challenges, and including the language. As much as we were studying an English medium, you still had to clerk patients because most of these old age patients were only speaking
Russian. Yeah, but in Ukraine
Yeah.
they speak Russian.
They
Same
do
by the
speak
even us
Ukraine.
we had.
The younger generation speak Ukrainian. I think it's a fairly new language. I don't
Oh,
know.
okay.
But the older generation,
They all speak Russian.
Russian. So you have to clerk the patient in Russian.
Same by the even us. I don't know if it's the same. Maybe I'll ask that. But even us, we also do the same thing after, especially when you go to 4th year.
Yeah.
That's when you start actually like going to
Yeah.
hospital and doing your
Same.
rounds.
Same.
So by that time you have to be able to, your Chinese better be really good. And by the second year,
How
that's
is
when
your
we did
Chinese from
HSK. We
how
did HSK.
how good is your Chinese?
Now
Yeah.
I feel like I've forgotten a little bit, but it's still okay. It's still
From
high
a scale of
I
1 to
think.
10, how would you grade it?
I would say a 5.
5, huh?
Yeah, I would
That's
say a
good.
5.
That's good. At least you can get
Do you,
fixed.
how's your Russian?
I think I would say the same 5,
Yeah.
6.
Because I think the longer you're out
Yeah,
of it, yeah,
it's true.
and by the way, it's been nearly 10 years since I've been. I think this will be like my 10th year because I graduated 2016.
You know, you're telling people your age.
Yeah, it's okay.
You
It is
might.
what it is. It is what it is.
Yeah.
Okay, so another thing,
Yeah, good.
I wanted to ask you, how did you cope with the pressure, like the endless studying, the emotional exhaustion? I don't think people realize how it really takes a lot from you. Why do you think a lot of like doctors are bald-headed? Just a quick joke. But come on, because it's tiring.
It is,
That
it
thing,
is.
like, oh my goodness, it's really
so
mentally exhausting.
It
So
is.
how did you cope with that?
I think for me,
But the PS,
I-
he doesn't have a bald head.
I'm okay. A few more years until I visit Turkey.
Okay.
So
Does
anyway,
he go to Turkey?
yeah. Anyway, so what was I saying? Yeah, you
How
asking
did
me
you
about
cope? Yeah.
coping mechanism.
Yeah.
I would say, are you talking about now my professional life or
Not
you're
now,
talking
like during when you were
med school?
studying.
Okay, I didn't have a social life, to be
Yeah.
honest.
Oh.
I actually, from my first year of med school until my 5th year, I had a very small phone. This one, what is it called? The small one.
Kibambe.
The one that
Kabambe.
Kabambe. I had Kabambe. Honestly speaking, until 5th year.
What is it called? Nokia 3310.
No, not 3310. It's a bit.
3310 is later.
3310
Is
it's a
old.
bit
Oh,
old. Yeah.
okay.
This one was
Like those Motorola's.
the one that has a light.
Oh yeah.
flashlight.
Oh okay. Yeah.
I had that
Kabambe too.
until my 5th year of med school.
Wow.
1,
So
2,
how are
3,
you
4.
communicating with your parents? Did
I
you
had
have?
Skype. I had
Oh.
my laptop with me,
Oh, okay.
so I would call them. I used to download
And
Viber
when
on there.
did you graduate, dude?
No, it's recent, by the way. I
That's
graduated
what I'm
in
shocked because I
2018.
remember you were quite recent.
Yeah,
you were behind
I
me.
graduated in 2018. But you see, that's why I mean, like, I didn't have a social life. All my lectures, everything was in my computer.
Wow.
I would call my parents from that laptop, and that's it.
Good
That's
boy.
Yeah. Until now, the reason why I got a new phone in 5th year, towards actually the 5th year, there was a friend of mine who came to Ukraine. He didn't come for study purposes. Of course, people come for different reasons. And him, he was, I would say, transit, in the sense that
Okay,
he was,
yeah.
you know.
I think we know what
you know what I mean. Yeah. So he said, when I'm going, these people will take my phone away from me because they don't want to be traced back to them. So the day he gave me the phone, my phone switched off. The
Kabambe.
Kabambe switched off.
Oh,
It was
it was meant to
like,
be.
guys,
I'm done.
I had enough. I had enough. But
Was
anyway,
this your last year of
so
uni?
yes, that was my last year.
Okay.
That's when I got a smartphone.
Dude, that was
Yeah.
kudos to you, man.
Right? So at least
Kudos
that
to
is
you.
what.
So
that's
you
how
were really a good student.
Yeah, I was.
By the way, if you are less than that, please don't go into medicine.
Right?
Honestly, because I think people really don't understand how much it really takes.
It is.
It really takes a
So
lot.
exhausting,
Yeah.
and you know.
And like the fact that you're away from
it's
your
one-
parents, away from your family and friends.
Yeah. You have to figure out life on your own,
Really,
which also shapes you.
it does.
It does shape you. It does. You become much more
how did you cope?
responsible.
Because I feel like you
so-
were literally just deep.
yeah,
to
you're
the-
just- yeah, it's okay. At the end of the day, as long as you're on top of your class, you make sure you attend all your lectures, you
hope.
attend all your classes.
Were you ever coming back for holidays?
Yes,
Oh.
but not every time.
Okay.
Not every time. I would come maybe this year, next year I'll skip, I'll stay there. And the weather was extreme.
Oh yeah, same here.
Yeah.
Same in Wuhan as well.
Summer, I didn't like. I don't mind
Really
winter. Honestly
Yeah.
speaking, I don't mind winter because at least winter you can dress.
You can put
well.
on your jacket.
Yeah, you have heaters,
Yeah.
you know. But summer is so hot
Super
and
hot.
humid. You have to go to the park to
You
get
feel like
some
your
oxygen.
face is burning.
Yeah.
Well, I swear to God. But then how I coped,
Yeah.
good thing with us is because we had a lot of like I had a lot of close friends
Mm,
who we were always like looking out for each other. We were always like talking. We were always going out sometimes
mm,
just to like, keep the social life going. So I think that's one of the things that really
mm.
really helped me cope because
Yeah.
other than that, like it was very easy for you to be
Mm.
very overwhelmed
I know.
by because a lot of people by then
You do.
dropped out
Yeah.
during medical school.
Yeah.
Yeah.
That's why you need really good
Yeah,
friends.
you do.
Yeah.
Okay. So were you actually mentally ready for that? Do you think like you were mentally ready before
No,
you went
not
to?
really, not
Yeah.
really. But when it came, at least just the same way as you said,
Yeah.
I also had friends there. Majority of my classmates were Indians, so we didn't have so many Africans in my, the only I made quite a few friends who are very close. We
Yeah.
used to study together. We'll go to classes together in the morning
Mm.
and everything. We used to do basically everything together.
Oh, that's amazing.
Yeah.
I think for me, it's quite the same as well. Like it wasn't really too overwhelming while in medical school.
Yeah.
But one thing I was not mentally prepared for is real life after uni.
Yeah.
Like when we came back to Kenya
Mm.
and the things that was waiting for us, that's one thing I was super, super, super unprepared for.
Mm.
Because you don't really know,
Mm.
like, even the fact that we have to do internship and
Yeah.
then
No, first you start with pre-internship.
exactly. Like we didn't know any of that.
Mm.
I wish we were mentally prepared because at least if we knew of that information, even while in medical school, I think it would really help.
Yeah,
Yeah.
it's true.
Yeah.
I think what we really lacked mostly there when studying as okay, I wouldn't say studying outside, but as a student, life as a student is much more different because initially I thought because we were there, we were not getting enough hands-on skill.
I think we were in a bubble. Honestly, for me, I think
Yeah.
I was just in a bubble. I didn't really, we were just into books, reading, like,
Yeah.
because honestly, in real life, like as a real, like actual doctor in the medical field, things are really, really different.
Things are different.
Yeah, it really
Things are
are.
different.
Yeah.
Things are different.
Mm.
And I think maybe because we lacked this, what really helped me is the fact that I was like, okay, I'm lacking hands-on skill.
Mm.
I don't have this thing.
Yeah.
So when I start internship, I'll make sure at any rotation I'm in,
You are
I
doing
get
it
to,
completely.
do these things
Yeah,
under supervision, of course,
of course.
and not at the patient's risk because
Yeah.
people will think
But you still have to learn anything.
you have to
Yeah.
learn because at the end of the day, it will reach a point where you're on your own with
Yeah.
such a patient. You need to be able to manage that
To manage
patient.
it on your own.
Yeah.
But that's why, honestly, this is also another reason why I really wanted to do this episode. So, because I think a lot of people really want to go into medicine, but they don't really know the steps they need to take. So maybe we can just break that down a little bit. So right after uni, if you've studied uni outside of Kenya, so once you come back, you have to do something called pre-internship, which is how many
4 months.
4 months.
Yeah.
And then after
The
those
4
4 months,
rotations basically.
yeah, so you
internal
do
medicine.
internal medicine, surgery, gynecology, and pediatrics.
Yeah.
So after you've done those 4 months, then you'll be eligible to do the exam, the
Yes.
licensing
Yes.
exam. And then that one is theory and a practical.
Yes.
So after you're done with that, if you've passed, then you go ahead and do a whole year of internship. Yeah.
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 And also I think maybe when you start internship, you go to, you'll be sent to, they do balloting.
Yeah.
So you might end up getting sent to Muranga.
Yeah.
Yeah.
I was by there. I was sent to Muranga.
You're sent to Muranga?
Yeah.
Really?
Yeah.
Okay. Mine was Kapsabet or something. No,
I can't
first
imagine.
I go to Busambweni.
Hmm.
Then a friend of mine, he was from Coast.
Yeah.
He said, I want to go and do my internship.
Oh, why do we have the exact same story?
Yeah.
Because I even had somebody else who was I don't know if he lived near Muranga or he lived in Thika.
Yeah.
He lives in Thika. So he was like, can we exchange? So because he
nice.
got his at Mbagathi.
Yeah.
So we ended up, I ended up doing my internship here. in
Yeah.
Mbagathi.
Yeah. So I think maybe if you go to, instead of going to level 6 hospitals, which is also good,
Yeah.
like Kenyatta, Raila Odinga Hospital, you do get exposure But I feel like this level 5 hospitals at the periphery, you also do get a lot of hands of on skill,
You-
because this one then has residents. You know, the level 6 hospitals,
Yeah.
they have residents, registrars who, you know, when you
Which
rotate.
sometimes it really will take over and
Yes,
they would
so
want to
when
do a
you're
lot more.
in the ops guy in rotation, you want
Yeah.
to do C-sections, you want to do max stitch, whatever, they also want to do that. So there's no room for you to, you know,
Yeah.
get this exposure. But that's if you're passionate about surgical courses. But if you're someone who wants to do pediatrics or
Or IMED.
IMED, I think level 6 would be good. Yeah.
So for those people who don't know what is level 6 and what's level 5.
So level 6 is the highest. It's where now you have everything.
All the equipment,
all the
like all the
equipment,
CTs,
everything,
MRIs. yeah.
everything. I wouldn't say it's more to do with equipment, which is also part of it, but it has each and
Inpatients,
every
each department, like ICUs, HDUs.
yeah, and each specialty. You'll have a cardiothoracic surgeon to a neurosurgeon to
Yeah.
you know, pediatric surgeon to ICU specialist, anesthesiologist, and the like. Some of these level 5 they lack that. Yeah, so that's why you can't refer above the level 6. Level 6 is
the highest that we
you can
have
refer
here.
to.
Okay, so one thing I really wanted to mention is about mentorship. And I think that's one thing I'm really, really passionate about.
Yeah.
Because I think even me as a young doctor, I would really wish that I had somebody who mentored me, especially early.
Like you
in
see,
yeah.
the reason why mine was a casual decision
Yeah.
was because there was no mentorship.
Yeah.
I had to sit down and literally just say, you know, law is not for me, engineering is not for me, this is not for me, that is not for me.
Yeah.
The only thing that makes sense
is medicine at the time. So yeah, and so one thing I was talking about, like mentorship, especially as a young doctor, once you're graduated, as I was saying, like not a lot of people really know how to how the workspace is, what
Yeah.
to do, what not to do, what is the right way. Honestly, us we were just going with the flow. I don't know about you guys. Maybe you guys, by the time you were here, you a little bit knew about people who were before you.
Yeah.
Us, we didn't really know anyone.
Oh.
So we were literally just going with.
No, I had an idea when I was
Oh,
coming
us
back.
didn't have any idea.
No way.
We were just going with the flow. We had to. We
So you
went
guys
to.
didn't have like
No,
seniors
we didn't know the
graduated
steps.
before you guys?
No, we didn't know the steps. And since we were in China, coming back, we didn't really know anyone who was in the field or anything like that.
Oh.
So we literally just had to go. When we came back, we were like, okay, now where do we start? And then they send us to KMDP. I don't know if they still call it the
KPC.
same. DU.
KPC.
They say it's a C now.
Yeah.
So, anyways, we went to the
Kenya
medical board.
Practitioners and Dentists Union.
So
Because
we
union,
ended up
now it's
to the
council.
we ended up going to the board, and then that's when they told us now you need to do pre-internship. So we thought, okay, pre-internship, then we just ended up going to Kenyatta Hospital, and then Kenyatta Hospital go, no, first of all you have to go back to the board. You have to make sure you're registered. So they needed all our transcripts and stuff like that. Literally, we were just going with the flow. We didn't know what we were doing.
Yeah, I think
didn't know the
before you even go to the board,
Hmm.
you're supposed to go to
And certify.
the High Commission, University Commission,
Yeah.
the one in somewhere in Gigiri.
Yeah.
So you go
we
there.
didn't know all of that. So we just
Yeah.
had to do all of those steps.
Yeah.
Yeah.
Um,
So I wish there was like proper somebody who actually helped us with all of those steps.
yeah.
Told us what
I
we
think
needed
they're very
to do.
vital. I think they're
They
very vital.
really, really
I
are.
think anyone who is watching this episode
Yeah.
now and is doing medicine outside and they need to come back and practice here, then these are the steps you need to take. First of all, when you come, after you're done greeting your relatives and your friends who told you by the time you finish medical school they'll have grandkids. Yeah. Now you go directly to the University Commission. It's somewhere in Gigiri. I think we'll just put it somewhere on your YouTube. So when you go there, you certify your papers. You make sure that your university is a World Health Organization accredited.
And make sure whatever language you're doing is translated in English.
It is, yeah, you have to translate all your documents. And then after that, you go find a lawyer, certify your documents, take them to Kenya Medical Practitioners and Dentists Council, go to the board, do pre-internship. They'll send you to anywhere you guys want. Most people do it in Kenyatta, other people in Bagathi, Mama Lucy and the like. Do those 4 months. Make sure those 4 months you at least learn the conditions that are recurrent. if it's pediatrics, is mostly acute gastroenteritis,
The
pneumonia,
malarias.
malaria. There's actually a pediatric
Yeah,
protocol book.
yeah. Oh, yeah.
Yeah.
I think there's a protocol book for internal medicine, pediatrics.
And
Yeah, I
obsgyn
think
as well.
they did an
Yeah.
At the time, we only had the two.
Yeah, so obsgyn, you do preeclampsia, you make sure a placenta previa.
At least you know, like, the basics.
You know the basics, basically.
Yeah.
The dosages in pediatrics, the different types of surgeries, the acute abdomen and the like. So by the time you're done with the pre-internship, you're doing your exams, you at least have an idea. And obviously you have the knowledge when you do the what do you call the
Yeah, like, as long as you're
the theory.
yeah.
And then when you're doing your practicals, you know how to, diagnose different conditions and
Yeah.
treat and everything. So by the time you're done, I think you're good to go. You start internship
Yeah.
with a lot of enthusiasm.
And I think a lot of people also don't know the whole point of internship is for you to actually realize which departments you're good at, and for you to have, like, an intensive experience in all the departments.
Yes.
Yeah.
Yes. So that at least by the end, you know where you want to specialize in.
Yeah.
And if you are a medical officer and you're posted anywhere, should be able to work
To at
in
least
any.
work in whichever you choose. Okay, so one thing I also wanted us to touch is the fact that a lot of people actually assume that doctors are rich.
Huh? People do that? People assume that? I think maybe there's some truth to that. The ones who own businesses, I guess.
Oh, God.
Yeah.
So
Businessmen in who are
in the medical department.
Yeah.
So my question was, what is the financial reality of a doctor? And is the salary reflective of the years of study and sacrifice?
Honestly speaking, no.
Absolutely not.
Yeah.
Is my answer.
If that was the case, we wouldn't be having strikes every year.
Right?
Yeah. Actually, right now, Nairobi Metro.
I think some people like blind themselves to that. Like, because why would you think doctors?
If you're doing medicine for the wrong reasons, which is money, you're in the wrong profession.
Right. Actually, that's what I really wanted to address, because a lot of people actually think that doctors are rich. Like, a lot of the time, even they're like, "Oh, why are you complaining?" We really are.
Yeah.
And I say we're the brokers because the amount of time and effort that actually goes into studying medicine.
Oh my God, the good 6 years.
Right?
The struggles, the exams, the stress.
Yeah. I don't know about now, but let me just give you guys a rough figure, because by the pre-internship is free. You don't get paid for that.
Yeah, of course.
So after you're done your licensing and then you start your internship, I don't know about, like, if things have changed now, but like at our time it was like maybe between 150
around
to 120.
Yeah,
around that
between
time.
that
Yeah.
Yeah. And then once you do internship, obviously the first boom is crazy.
Yeah.
Like, you don't get paid until roughly
5 months, 6 months. Imagine us, we didn't. I don't think the first 4 months we did not.
No,
get paid.
us it was at least 2 months.
No, us 4 months we didn't get paid for the first 4 months.
Then you ended up getting.
Please just prepare.
Then
you get to the whole bulk.
The whole bulk. So it's a lot of money. I'm even shocked. Don't know what to do with this.
Yep. Actually, another thing, maybe today is not the day we talk about this, but the financial illiteracy of doctors is something we really need to discuss, because sadly, a lot of the time, especially because, people, even now, the people who are hearing this, I'm sure they're thinking 140, 130, but that's a lot of money. Really, it's not. It's not.
Because you can imagine you're doing internship.
And you're not.
You are there. No, you're there.
Now you need
from
rent.
Monday.
Yeah.
You're there from Monday to Friday.
Yeah.
And in these days, there are days you're on call.
Yeah.
And then on the weekends, there's a weekend you're on call.
On call, yeah.
So you can be on a Saturday and Sunday. So you basically have no life apart from that hospital.
For the amount of hours you're working, and that money is literally worthless. Plus, I think a lot of people also don't realize that during internship, a lot of people are sent outside of their homes. Like outside of Nairobi, if you live in Nairobi. So you're not living with parents. There's rent that you need to pay, bills that you need to pay, and probably it's honestly.
You can imagine your parents paying for your school fees.
Imagine.
Throughout med school. You finish, you become a doctor.
And now they're thinking, okay, now we're going to rest.
Yeah. Where? Where?
Yeah.
I think with the finances, no, medicine is not the best
Yeah,
job.
it really is absolutely not.
Even though
paying
at
job.
a consultant level you might get a
Yeah.
decent amount of money,
Consultancy, we mean
but
people who
still
actually
have
they've done
specialized.
their masters and they've
Yeah.
specialized.
So they might be getting enough money,
Yeah.
but I don't think they also have a life.
I think people actually who earn a lot is the people who actually have like clinics or
Yeah.
hospitals. Yeah,
Yeah.
like the business.
And it depends. If your hospital is not known, and it's not in a strategic place,
Yeah.
the walk-in of patients is
Yeah.
very minimal.
There are only very few doctors here, by the way, who really get paid well.
Yeah.
Yeah. So another thing I wanted to maybe touch on is, why do you think many doctors, because I feel like with all of these challenges that we talked about, I think a lot of it's very easy for you to fall back and actually give up on the profession, which a lot of people actually do. So because they leave the profession. Why do you think that's so?
I think most of them, there are a lot of factors to why people leave this profession, because at the end of the day, you're always dealing with diseases, death,
Yeah,
and
it's emotion. It takes an emotional
it takes a
toll.
lot of it takes a lot of mental well-being to
Yeah,
remain in the
in the
profession.
profession.
Then the other thing, some people may not feel like that this profession is rewarding.
It's really, yeah, that's so true.
Yeah.
Yeah.
Other people might leave because of the finances. They want to go into business
Yeah,
and make a decent amount of money. So there are a lot of factors as to why people leave medicine.
yeah.
Yeah. So yeah,
I think you've already covered a lot, because that's exactly the reason why a lot of people leave.
people have different reasons
Yeah,
for
yeah.
leaving medicine.
But and for me, I think one of the biggest reason is the fact that a lot of people, people are not prepared well enough for the profession.
Yeah.
I wasn't, at least, and I know a lot of people are not as well, because they don't really know what it's the real life in actual working in a hospital. What it takes is not something that a lot of people are ready for. Yeah, and it can easily overwhelm you, especially the emotional toll that we're talking about, because you'll be surrounded by death all the time. You'll see a lot of people dying. You'll see a lot of people who are suffering in different ways. So if you can't really handle the emotional toll on that, it can be really, really difficult.
Yeah.
Yeah.
Yeah, honestly speaking, it is. We are not built the same. We are all built different.
Yeah.
There are people who can, withstand a lot of pressure. There are people who cannot.
Yeah.
There are people who may venture into business and feel like this business is making me enough money.
Yeah.
Why must I struggle?
Sure.
Which is true. You can still have your degree.
Yeah.
I don't think people should be shunned because, this is a doctor. They've studied for 6 good years. What
Why
are they
would you
doing?
leave?
Why would they
Yeah.
go and do, business and all these things? Unless you're in that profession, I think you shouldn't have any comment.
That is so true.
Right?
And another thing, by the way, for me, I feel like unless you're the one in their shoes, don't have an opinion about it, because you never know why this person is doing what they're doing and why they actually decided.
And people should not, you're not entitled to know.
You're not a child. You're entitled to your own wants and needs. If you know this is not for
You're not
you, you can
entitled to
easily
know
do-
why this person made this decision.
right?
Unless someone decides to share that with you,
Mm-hmm.
I don't think it's your place.
Please say louder. Say it louder. Oh yeah. Now that we're talking about changing careers, sadly, one of the things I actually realized way after I was practicing as a doctor is that medicine is not a transferable skill.
It is not.
It's really
Because
not.
as doctors, what else do we
What
know?
else do you really
apart
do?
from-
Imagine what else. Now you've left the career. What else?
We know
is
nothing about politics.
or math
We don't know anything
or
about math.
anything. You don't know
Yeah.
anything about anything,
Yeah.
which is so sad.
Yeah.
Yeah.
Yeah. That's why you find doctors chilling with fellow doctors.
Because nobody else will even understand.
like-
Plus, that's why for me, honestly, I always recommend to people, before you even go to medical school, is please be very sure that this is actually the career you want.
Yeah.
And for you to be able to do that, if you can actually take time and go maybe intern for a doctor, or actually if you can hang around doctors, ask as many questions as you can,
Yeah.
and actually try to figure out what life is actually as a doctor, because a lot of the times it can be like doctors are high and mighty. Like, oh my goodness, it's like the pinnacle of like, life that now you've become a doctor. So please don't let that mess with your mind. Actually go research.
Yeah.
Like, get to know what actually, like,
Yeah.
it takes for somebody to
For-
do medicine.
to
And if there's somebody out there that who wants to do medicine, please just send them this episode so that they can actually understand
Yeah.
what it takes for you to
Yeah.
become a
Yeah.
doctor.
And if they have
Okay?
any questions, they can reach out to
Of
you
course, of
any
course.
time.
Another thing, oh yeah, with the transferable skills, I would also say, if you decide to ever leave, like, and this is for advice for anybody who decides to leave the profession, I would say just sit down with yourself. Like, try to what is it called? Audit yourself. Like, see what hobbies you have.
Audit.
No, I mean, like, just
I know audit.
try to figure out
Yeah,
what
that's right.
you like, what your hobbies is, what you enjoy, and just maybe try to figure out.
And
Because
also check your
goodness.
personality. Are you someone who is, empathetic?
Yeah.
Are you willing to listen to other people's problems every day?
And sadly, one thing I always say is like, sadly, if a lot of these other you just have to start over.
Yeah.
Because now medical, hey, what's you in there, you in there.
Yeah.
Like, it's not transferable. So it's not like, people who've done accounts and now they can go into a lot of different
Yeah.
professions if they've decided they don't want to work at a bank anymore. You know what I mean?
Yeah. Honestly, I feel like we have butchered medicine. Can
No.
we talk about the good part?
Okay, let's get into that because that was the
One
next one. Many people choose medicine because of the. Oh yeah. Okay. One more thing before we actually go to the good part. A lot of people actually choose medicine because of their parents, and actually, I would really, really highly recommend for you not to do that. If your parent actually wants for you to do
I
medicine,
have a different take.
you have a different take.
Yeah, go on.
Okay, so I would say if your actual parent wants you to do medicine, I would actually think twice. Not because it's a bad decision; it might be the greatest decision, but it also has to come from you. Like,
Yeah.
you also have to literally sit with yourself and see. For example, like 10 years from now, am I still going to want this? And what is my like reasons for doing it? Is it because of the money? Is it just because of like, making my parents happy? Because I know a lot of people who actually took the degree and they took the certification. Afterwards, they took it to their parents and be like, here, I've done it for you.
Oh my!
I'm done.
That's great.
And
great.
why would you do that? Because now you've wasted what, 6 years, 8
Of your
years
life.
of your life.
And these are the most important.
Really time of your life.
Oh,
So I would
20s,
suggest
when you're
against
very
that.
energetic.
Yeah. I would suggest against that unless it's like you've literally figured out and this is really the route you want to
So
go.
let me play the devil's
Please.
advocate.
Uh-huh.
I feel like as parents, now you're a parent.
Yes.
Of course, I'm a parent.
Yeah.
You know what's best for your child.
Yeah.
Obviously, you're the one who you've spent basically the whole of their lives with they've spent it with you.
Yeah.
So you know them.
Yeah.
You know this child is capable of doing this.
Yeah.
So because of lack of mentorship, and you don't have people who are mentoring you into doing these different courses.
Yeah.
If your parent suggests, at the end of the day, of course, it has to come from you.
Yeah.
But there are people who have no idea
What they
want to
Yeah.
do. So if you tell these people, don't take the advice of your parents, if they take
They will get lost.
medicine, they'll get lost.
True.
So I think obviously take whatever they tell you, assess it yourself, sit down with yourself, see, is this something that I can do or is this something that I can't? If you can't, then now make you the decision of not wanting to do. But if you can and you feel like, oh, obviously they have, obviously maybe your parent knows you are very kind, maybe your parent knows you are very helpful. And these are traits you need to become a doctor.
It really is.
It's more rewarding. And I'm not saying all doctors are kind and helpful.
Yeah.
But if
it
you
should
have
be.
these
They
traits,
all should be.
yeah, they should be. If you have these traits, because they say medicine is the only job where your office is where where a human being is at its
Vulnerable.
vulnerable. Yeah. So you see this person's vulnerability.
Yeah.
They share things they can't share with other people.
Other people, that's
Yeah.
true.
So if you're not empathetic and if you're not kind and if you're not willing to help, then I think this profession is not for you.
Yeah, that is so true. And one more thing I would maybe say, especially to parents who are encouraging the kids to go to medical school, I would say please try to find this child of yours somebody that can mentor them.
Yeah.
If you, for example, know somebody who's a doctor who's already working, maybe get that person in touch with your
Yeah.
daughter or son,
Yeah.
so that they can, like, ask the questions, like they get to know the profession in a very deeper way.
Yeah.
I just don't appreciate that this glorifying, of the medical career, which I really don't agree with.
Especially our community.
Exactly. It really romanticizes and glorifies the career, which
Yeah.
of course is something to glorify, but it's also really, really, really difficult. And I would really highly, highly suggest that you either get a little bit of experience, talk to the right people so that you can make your decisions better. So that 10 years later, you don't actually realize, hey, this was the wrong decision to make, if that makes sense.
Yeah, I feel like and most doctors are reachable.
Yeah. Yeah,
The
they
six-
really are.
yeah,
Yeah, because they were the ones who had it the worst, because so they're willing to help.
Yeah, so reaching them is not even a big deal. You can even go to a clinic one day
Exactly.
and you're going there to be, seen by a doctor.
Yeah.
And you can bring your child with you.
True. And so they can just ask the questions.
Yeah.
Okay. One thing I would say is, because honestly, it's really risky for somebody to go ahead with medicine if they're not really sure that's the path.
Yeah,
I would really, really, honestly, I feel like I'm repeating this because the amount of people who actually leave the profession is more than the people who stay. And that is a lot of different factors, but a huge one is for it was just not the right decision.
Yeah.
So let's talk about the rewards, as you say. What is the things that you really enjoy as a doctor?
As a doctor, obviously now I do work in 2 different hospitals. The beauty part is in both these 2 hospitals, I work in emergency. So a patient is brought in, was assaulted, had a head injury, was involved in a road traffic accident. We manage that patient so fast. They go to theater.
Yeah.
We do the neurosurgeons, they do craniotomy, they do barhole. The next day, the patient is walking
Oh, wow.
and it's out.
Yeah.
And then they come, they say, thank you for saving my life, you know?
Oh, that's
A few weeks ago, I was driving my car and I was heading for a shift that was starting around 4 p.m. till midnight. So I happened to see a place where there was a lot of commotion. There were a lot of, motorbike, these boda drivers and stuff. They're standing there. And then I'm looking at the place, I see 2 people injured. And they're lying down. One is crying in pain.
Wow.
And he is bleeding like no one's business. So I'm telling them, when did this happen? They're telling me like maybe 20-30 minutes ago. And I'm telling them, why do you guys have these people here?
Exactly. Why are they not rushed to the hospital?
They're like, oh, we're still waiting for ambulance. We're trying to reach an ambulance. I said, listen, I'm going to a hospital. You can put them in my car.
Okay.
Both of them.
Oh, wow.
So I took both of them, and then there were 2 small kids who were Somali. They said, can we come with you? I said, it's fine, come. At least you can be sorting them out as I'm working.
Yeah.
So I took these patients there, and one was of Chinese descent. He ended up getting admitted in the high dependency unit. The other one was a Kenyan. He was the motorbike driver. The rider. So he sustained even worse injuries. But when you look at them physically, you'll think this one is much more emergent. But then now, because of financial constraints, they were, discharged and taken to a different hospital.
Oh, wow.
So the rewarding part is that guy that was admitted in HDU was discharged home.
And he was just.
And then the relative reached out and they were like, thank you for saving my.
Oh, that's beautiful. Okay, let me tell you a rewarding story that I had years ago when I was doing my internship in Baghdadi. So there's this woman who had 5 miscarriages before. And now the 6th time, she came to the hospital and she's like, okay, guys, this is my last chance. Like, I'm pregnant now, but then I always lose my pregnancies. Please help. So we ended up, I was with her for the.
Basically, bad obstetric history.
Yes. So I was with her for I think she came to us when she was like 2 months pregnant. And I was with her the entire time. So I was telling, she was coming to the hospital, imagine, every 2 weeks, just to make sure. That's how bad she wanted a child. And at the end of it, we ended up she ended up delivering, and at the time, like, because of the bad history, we ended up choosing to do C-section. So she had the baby by C-section, and she actually named the child after me.
Oh my God. Yeah.
And she still contacts me, and oh my goodness, that's one of the little things that really make you happy.
Yeah.
So we have those kind of stories, and it's really impactful for you to actually see the impact and
Yeah.
the like the touch you have on humans, especially as you said before, like because in our offices and in our line of work, you see a lot of like people that are in the most vulnerable state of their life when
Yeah.
they come to you.
Yeah. 100%. Like it's a very rewarding because
Yeah.
at times you see a child who's very sick.
Yeah.
You want to admit he has a difficulty in breathing. You want to admit even all the way to ICU, and then all of a sudden a few injections here and there, nebulization here and there. The kid is back to normal.
Oh, that's so
And then
beautiful.
you were like, what?
And sometimes you realize like the most little, like, things can actually make a huge difference to people.
100%.
Like even fluids.
Yeah.
Like sometimes you just give somebody fluids, you're like, oh, wow, it actually made a huge difference,
Yeah. So dehydration is no joke.
Yeah. So and the other part of the question is, what is the most challenging?
The most challenging part in this career is as if I can speak from what do you call
Your point of view?
my perspective is it's very hard for me, at least right
Yeah.
now. I'm so used to working and earning money, as much as however little it is.
Yeah.
I have a family and stuff. Now starting residency is a challenge because for you to start residency, you have to stop your work.
Working, true.
Yeah.
But now you also need to find a way to pay for that.
Yes.
Yeah.
You have to be paying. It's like you're going back to school, basically.
Yeah.
So one time I'll find a sponsor and then.
Yeah. If you're listening to this,
Yeah, please.
and you want to sponsor next time,
Sponsor me. Sponsor. It's only 3 years,
right? We should. But
Yeah.
honestly, that's a huge challenge. And
That's a
another
challenge.
thing that I would actually say, like what we talked about, the reward, I think the complete opposite can also be very challenging, at least for me, because sometimes, yes, you get some patients that are doing really, really well with the medication, or like the steps you took as a medical doctor and the treatment you've done, and it really helps. But sometimes you actually get the opposite as well, that you see people in the worst state, and sometimes they can't even be helped.
Yeah.
And then you either lose them, or clearly you need to send somebody home.
One thing that reminds me is when you're studying these things and when you are doing your internship, you don't think these things can happen to a loved one.
Right?
Like
That
it's
is very
impossible. You're like,
yeah.
what?
And imagine
Heart
you're a
attack.
doctor,
Who?
and you're a doctor. How are you can't help your person.
Fatuma has a heart attack.
Imagine.
It's impossible.
Yeah.
So getting now that and then at least when someone knows you're a doctor, they know that you're capable of treating each and every disease.
Yeah.
So your relatives, the neighbors,
Yeah.
everyone will come with you with their issues.
Yeah.
Tell
they'll
you,
ask for
okay, I have
protocol
this rash.
things.
Okay, I'm not a dermatologist,
Exactly. I think people don't
but I've
realize
seen
that.
this rash maybe somewhere.
Yeah. And you can
Try
advise them
this.
to a
Yeah.
certain extent,
Yeah.
but they still need to see
a specialist or whatever.
Okay, one more thing I also wanted to mention about the challenge is that the mental challenges as well.
Yeah.
I would suggest to any doctor out there, if you're actually working in the field, please have a mental health specialist who works with you. Go see a psychologist, talk to somebody, like even because those hard times, like whenever, honestly, for me, I think it was the second night I was working as an intern. I lost a 5-day-old baby, and it was the worst thing. Like I had nightmares for months afterwards.
It's really bad.
It can really be bad, and it can really affect you.
And then the other thing that we really lack
yeah,
is, especially working in an emergency setting,
yeah,
you lose a patient. There's no debriefing moment.
there isn't really.
There's
I
no
think
debriefing.
that was one of the things I
Like
would
you
love
go
to
on
change. Like nothing happened,
The other
and they
day-
just expect you to just move on.
The other day there was an intern. We were doing resuscitation and he was there with us. And then once we were done with the resuscitation, we didn't achieve ROSC.
Yeah.
Patient was succumbed
Yeah,
and was certified dead.
yeah.
We went on with our lives
Lives like
like
this,
no one's
which is
business.
a good thing.
And you know,
It
the
can be a
intern,
good thing as
let me tell
well,
you, it's
but it can
the
also be
intern,
really, really
the intern
messy.
came to me and he's like, Doc, I don't feel well.
That's
I've
true.
never experienced such a thing. Please, can I go home?
Yeah.
I told him, okay. You know, there's no point of you staying here when you're not in the right state of mind.
Yeah, honestly, that's why I will forever suggest, because you know the amount of doctors by there who take their lives because of you know, like mental health problems. Please go see a psychologist. Please go see a counselor. Like these are not things that you should be ashamed of.
100%.
It can be really, really difficult
Yeah.
out there.
I think most people view it as taboo.
Yeah,
They think going to a psychologist, a counselor,
yeah.
psychiatrist is you have to have
Shame. They have a lot of shame
yes,
around
yeah.
it. Yeah.
And it's not a bad thing seeing a therapist.
Oh, wow.
Yeah.
So, you guys, we've talked a lot.
Mhm.
So, the last question I have is, what do you wish somebody had told you about the career before joining medical school?
I think the cons that it comes with.
Yeah,
I think I was more focused on the pros
positives.
of, you know, helping
Yeah,
patients, doing this, bringing an impact to someone's life,
yeah,
you know. No one prepared me for the cons it comes with.
yeah,
The financial struggle it comes with, you know, the pathway of residency and stuff like that. But yeah, I wish those things were things I was told. What about
yeah.
you?
I think the same. I wish I was prepared more. Honestly, I think out of all the things I talked about before, I wish I had a mentor. I wish I had somebody who was, you know, like older than me, who was in the profession that I could go to, you know, like to ask questions. Because sometimes, you know, like the hospital can be a really competitive place as well. And sometimes there's very little, you know, because all of these, even the senior doctors are very busy. So you rarely get time to actually go
Yeah.
ask for advice.
Yeah.
So I wish I really had somebody who I could go to for advice, like a mentor.
Yeah.
I wish I had, like, you know, I think we already talked about everything, but I wish I had somebody who would literally just guide me through, like
Yeah.
if there was like those sort of deaths and you know, like bad times that we had. I wish there was somebody out there who actually gave us a debrief.
Yeah.
I wish there was like somebody who was like, okay, this happens. It's okay for you to
But I
take
feel
some
like
time.
even if someone tells you all these things,
Yeah,
unless this happens to you
yeah,
and you experience it,
yeah.
I
No,
don't.
I mean after the experience.
Yeah.
For example, like with
Yeah.
that
Yeah.
internship that you said,
Yeah.
after the experience, I wish there was somebody who actually said, yo, this happened. It's okay. Like maybe this is what you need. Maybe
Yeah.
take some
Yeah.
few minutes and just try to actually just take you
Yeah.
through it. you
Yeah.
know?
Yeah. Yeah.
Yeah.
That is very key, by the way.
Yeah.
That's very key.
Yeah.
That's very key.
Because I think a lot of the time, like people, doctors just like, oh, like they just push through. See, Zoya, like these are the things you see all the time. Just move on. The moving on is just so
I know
easy, and
some
sometimes it
people
can affect
who
people.
I know some people who go to their cars and then they start
Cry.
crying. Yeah.
Me too. That was me.
So the,
Honest, that was me. I would go and, you know, like take it out. I would have sleepless nights. But at the end of the day, you know, like one thing that really kept me going was the good part, the reward, like those good patients, those patients that were really helpful, that I could see, oh, like my efforts are actually like making sense to somebody else's life. Yeah.
and that's why there are some certain places I would never specialize in. Something like oncology,
Oh,
hemato-oncology.
yes.
These
It's really difficult because, you know, like this,
cancer with leukemia.
yeah,
The outcome is not always the best.
mostly actually.
So you're always dealing with deaths.
Yeah.
Even though trying your best, giving all this chemotherapy, radiotherapy,
There's only so much you can do.
there's only
But they honestly, whether it's oncology or not, at the end of the day, like something can happen to somebody who was literally fine 5 seconds
Yeah.
ago. Like, like hospitals are very, very
unpredictable.
very
100%.
unpredictable. Because, you know, like there's also another patient that was doing so well last night. The next morning, once you get back to work, they've passed on.
Yeah. I've
So,
seen,
yeah.
I've seen multiple times. I've seen such cases.
Yeah, subhanallah. So, anyways, you guys, if you have a doctor in your life, if you know somebody who's a doctor, please go give them a tight hug. Give them a hug, because that
And money
like,
too, and money.
and
Please,
money.
money. It's very important. Huh?
Go give
We
them
are broke. Surprise us. Our M-Pesa numbers are ready.
right. So go give them a hug and an envelope of money. But then, you know, like it's a really popular Chinese tradition for people to get like money in a nice, especially during weddings. They normally give them money in a nice red envelope.
Oh,
So do that. Eid is coming, right?
I think I should
No.
go to China.
Yeah.
I need that money.
Right?
Yeah, I need that tradition. We need to adopt some tradition there.
They really do. I hope you guys have enjoyed the episode. I hope you guys have gotten, have understood doctors a bit better. And if you guys have any questions, leave them on the comment section, or just DM me on Instagram, the Fatima Edit, or at the Cultured Voices podcast page on Instagram, or just ask the questions on the comment section.
Yeah.
And then inshallah we might just
Thank
do
you
another
for having
episode.
me.
Thank you for being
I didn't
here.
expect it to be this lively. It's
Yeah.
like, what am I even going to say there?
Oh, I'm glad you enjoyed it.
Yeah.
So if you guys know anyone who is in the medical career or is planning to do medicine or go into that career, please share the episode with them. Trust me, if I went back in time and I had something like this, I would really, really appreciate.
I think it is very it's very crucial.
Yeah.
So
anyone who wants to sponsor Daktari, please.
please, my M-Pesa number
Contact me.
somewhere.
Right?
Yeah. Please like, subscribe, and put the notification button on for further episodes. Stay tuned.
Thank
I
you.
always wanted to say that. So
As Daktari said, please comment and tell us what you want to hear next time. And if you have any questions about the medical career or anything else, I would love to have Daktari back.
yeah.
So tell us what you want to hear. And until next time, Assalamu alaikum.
Bye.